So today we're going to talk about testosterone. Testosterone is the male sexual hormone, or at least it's traditionally thought of that way. It actually mediates sexual arousal in both men and women and has something to do with orgasm. And so it's important for those reasons. It's also important because it has something to do with hair loss as well as prostate enlargement in men. There are a lot of people who are diagnosed as having low testosterone levels. Some of them fit the traditional bill of someone who should have low testosterone. Some of them don't, and some people respond well to testosterone treatment and other people don't. And so we're going to talk about why that is. But in order to get there, we have to talk a little bit first about how testosterone is generated and carried in your body and how it does what it's supposed to do. So like all other sex hormones, testosterone comes from cholesterol. Cholesterol is absorbed in the intestines or produced in the liver, and from there it's carried to other tissues like the adrenal glands, the testes, and the ovaries, where it's converted to other metabolites like pregnenolone and DHEA. From DHEA, we generate the other sex hormones, which are estrogen, progesterone, and the one we're talking about today, testosterone. Testosterone subsequently is carried in the bloodstream to the target tissues. It can only be carried through the tissue and the bloodstream in conjunction with something called SHBG. It's called sex hormone binding globulin, and this protein carries the testosterone through the bloodstream to the tissues where it's going to do what it needs to do. There is a there's a constant ratio between the free testosterone and the amount which is bound to this protein SHBG. Only the free testosterone can actually do what it's supposed to do. So you can think of this bound material as something which is in storage. And then when some of the testosterone is free, then it can bind to the receptors, and in the receptor it causes some things to happen in the cell, which carries the message of the testosterone to the cell. Now, it turns out that not all SHBG is the same. It turns out that not all the receptors on the cells are the same. And so if you imagine that testosterone is a round shape, it really likes to bind to a receptor which is also round. However, some people have square receptors. And probably a much more accurate term to use would be that you can either have a round receptor or a square receptor. The round receptor, if the testosterone binds it, let's say it will cause 100 molecules of testosterone to be generated in your body, whereas if it binds to the square one, it only causes 50 of them. So you can see how the reaction would be a lot more efficacious here as opposed to here. And there are things that cause the testosterone receptor to change their shape and be more receptive to the testosterone that you have, so that for the same testosterone levels, you'll get a lot more out of it. The main one that we know of is growth hormone. And so a burst of growth hormone will make your testosterone worth a lot more than it would be otherwise. And the easiest way to get a burst of growth hormone is to exercise, which is maximal exercise for 30 seconds. So not walking, not jogging, but running as hard as you can, or biking as hard as you can, or something that gets your heart rate going up very quickly and causes you to break a little bit of a sweat. Anyway, subsequently, once the testosterone is in your cells, it will do two things. It can affect the DNA in the cell, which affects the production of certain proteins that do the work that we're looking for, or it's converted to DHT, otherwise known as dihydrotestosterone, which is the more potent form of testosterone. And so a lot of the medications that affect the um, that help with hair loss, like Propecia, or medications that help to shrink the prostate, work in this area where they prevent the testosterone from becoming activated to dihydrotestosterone and subsequently prevent the hair loss or prostate enlargement that's caused by the more potent form of testosterone. So what I want to talk about is why the three different kinds of testosterone deficiency. One of them would be low testosterone. Basically, you just don't have any testosterone, your testes are not making any. Second one would be elevation in SHBG. So there's a condition known as andropause. And andropause is when you're still making plenty of testosterone, but you begin to make a lot of this sex hormone binding globulin, which kind of neutralizes the testosterone that you have. It carries it through, but as long as the testosterone is bound to the protein, it cannot do what it needs to do. So this happens to a lot of men as they get older. They're still making testosterone, but they also bind the thing that they make the thing that binds it, and so they don't have any free testosterone. Besides older age, there's one supplement that reliably does this, and that's called alpha-lipoic acid. I would say the highest levels of SHBG that I've ever seen have been in people who were getting alpha-lipoic acid infusions for hepatitis C. Another form of low testosterone is when people do not have the hormone that stimulates the production of testosterone, and that's called central hypogonadism. Basically, you have normal testes, but the brain is not sending the signal to make the testosterone. Testicular failure itself is basically when the testes are often atrophied and they just don't make any testosterone. In that condition, people respond very nicely to testosterone replacement. However, again, SHBG is important because for most people, when they have low testosterone, if they don't have enough SHBG, they will never be able to pick up testosterone from the skin and carry it into the bloodstream. And that's how most testosterone replacement today is done, is through commercial preparations that you put on a gel or a cream on your skin, and that carries it and then the SHBG comes and picks it up from the skin, brings it into the bloodstream, and takes it where it needs to go. If you don't have enough SHBG, that process is not going to happen with most commercially available testosterone preparations, and those are the people who need to get injections for testosterone. Another thing to keep in mind is that some people convert testosterone rapidly from the usual form to the active form, dihydrotestosterone. So you will see people who will have low testosterone, low or normal SHBG, but high DHT. And so those folks, if you only screen them by checking the testosterone, they will look like they have low testosterone, but they really don't. They have a lot of the active form of testosterone. So to go back, it's important if you want to assess someone's testosterone status to check dihydrotestosterone, testosterone, SHBG, as well as another hormone which is called LH, luteinizing hormone, which comes from the brain. So looking at all four of those numbers is really what's required to diagnose someone as having inadequate testosterone, and then subsequently by looking at all four you can say, where is the problem? Is it that they don't make any testosterone? Is it that they're not activating their testosterone? Is it that the brain is not giving the signal to make testosterone? Or is it that they just have too much of the protein that binds the testosterone and can't that doesn't allow the testosterone to be free to interact with the receptor? The last part of the puzzle is to determine whether you have this kind of testosterone receptor or that kind of testosterone receptor. And that's something that we just don't have the science to be able to do at this moment. However, you can imagine that it would be possible to isolate your white blood cells and test the testosterone receptors, but we're just not there yet. So this is the best I can offer you as far as an understanding of low testosterone conditions, and hopefully soon we'll be able to take the next step and be able to complete the puzzle.